Whether you are aware of it or not, chances are someone close to you has a mental health problem. Mood disorders and depression affect millions of Canadians. For many Canadians, dealing with seasonal affective disorder, also known as winter depression, is not uncommon. In fact, some 15% of Canadians will endure a mild case of seasonal affective disorder at some point throughout their lifetime. Studies show that 2 to 6% of Canadians suffer from what can be a debilitating severe depression as the seasons move from summer and fall into the grip of winter. One strongly supported theory is that the winter blues are in large due to a reduction of daylight hours, as seasonal affective disorder increases in prevalence the further north from the equator you go as the daylight hours decrease over winter months. Today we look at who among us is most at risk, the symptoms as well as the current treatment options available for seasonal affective disorder. Hey Calgary, I'm Kevin Chorney. Thanks for joining us tonight. This evening we're talking about, seasonal affective disorder, and I'm joined by Sara Jungen as well as Dr. Scott Patten. Maybe I'll start with you, Scott. Tell me a little bit about yourself, your field of study. I know you're heavily involved with a lot of research, S.A.D. A bit about yourself, if you would.
I'm a psychiatrist at the University of Calgary, and my academic discipline is epidemiology, which is the study of patterns of diseases in populations. So specifically, I'm a psychiatric epidemiologist. I study the distribution of mental health issues in the Canadian population.
Okay, thanks for taking the time.
Pleasure.
Sara, yourself, you're a registered psychologist. A bit about yourself and your practice, if you would.
Yeah, so I operate a private practice called Menla Psychological Counseling, where my associate and I provide counseling mostly for concerns such as depression, anxiety, relationship difficulties, those sorts of things. And we specialize in mindfulness-based approaches and trauma therapy.
Mindfulness-based approaches.
Yeah.
Cool. I want to touch a little bit more about that as we get into our discussion here. Let's start with S.A.D, though. I mean, like many other Calgarians, I loathe the winter. I mean, the winter's no fun, right? I can't help but think I probably likely suffer from the winter blues. But where do we draw the line from, suffering from the winter blues into full-blown seasonal affective disorder? What are the symptoms?
Yeah, so winter blues and seasonal affective disorder, they'd sort of be on a spectrum, on a continuum, with seasonal affective disorder being a much more severe form of winter blues.
Okay.
And so some of the symptoms are things like reduced energy, being pretty lethargic, sleep disruptions, so needing much more sleep, yet not feeling rested from it and having a hard time getting up, changes in appetite, such as often craving carbohydrates, things like cookies and pastas and breads, those sorts of things. Another thing is changes or difficulties with cognitive functioning, so perhaps memory is not as strong. Those sorts of things. In really serious cases, it can also include thoughts of suicide.
Wow, okay. So then, Scott, how does the seasonal affective disorder diagnoses differ from traditional clinical depression?
Well, in the official diagnostic nomenclature that's in use now in psychiatry, it doesn't differ in terms of its presentation.
Okay.
It still has to fall within the scope of what one would be willing to call a mental disorder. That means there has to be a syndrome consisting of signs and symptoms, as Sara's just described.
Okay.
But it has to be severe, it has to be persistent, and it should interfere with functioning, cause a lot of distress, or be associated with some kind of danger. So this is the definition really of what we call major depression.
Yeah.
That would be what many might call clinical depression, as a way of distinguishing that kind of syndrome from the day-to-day sadness or reaction to stress that is a part of everyone's life.
Right.
The difference here is that the pattern of onset and resolution of that syndrome would be, to some degree, characteristic over the seasons.
Right.
So it can actually be in the winter or in the summer.
Oh, is that so?
Yeah, as long as there's a persistent pattern, which is usually defined as most of the episodes that a person's had in their life would have an onset and a resolution in a specific season.
See, and this makes a bit of sense. I think the common misconception then would be that seasonal affective disorder is caused simply by a lack of sunlight and then a lack of vitamin D. Is that a misconception?
I'm not sure. What would you have to say about that?
Well, vitamin D, I would say yes.
Really?
There's no doubt in our climate,
Yeah.
many of us will develop a seasonal vitamin D deficiency. But that has not been strongly associated with the mood changes. And vitamin D supplementation is not considered at this stage an evidence-based treatment for seasonal affective disorder.
It's more about kind of what you alluded to earlier, where I think maybe a traumatic childhood experience in the summer, for example, and then people as they move into the summer months, it triggers this. Is that kind of fair to say, or is there more to it than that?
Well, we're talking about mental health here.
Yeah.
There's a lot of unknowns.
Right.
So the exact mechanisms linking S.A.D to the seasons, or, I would also say that some people with bipolar disorders also have a seasonal pattern to their experience of mental ill health. So the exact underlying pathophysiology is not well known.
Yeah.
It's thought to have something to do with shifting circadian rhythms, because it is thought to be a more burdensome issue the further you get from the equator.
Right.
But the exact mechanism by which that could occur is not fully understood.
So still a lot of research ongoing then, I would assume.
Yes, certainly to understand the underlying cause. Now that doesn't mean that people can't study treatments, and there's lots known about what the effective treatments are for S.A.D.
Of course, I want to get into that as well. We're going to jump to a quick break, folks, and check in with the Rant Pack. Stay with us.
I don't know anybody personally that suffers from seasonal affectiveness disorder. I know that everyone gets the winter blues, and that's understandable, I think, because you see a lack of sunshine, more darkness, and that naturally affects the melatonin levels and the production of the happy hormone when you normally get that in the summertime. So it's my understanding that a lot of people see some success with light therapy. I would prefer that over the drug treatments, and obviously a good support system with family and friends. Exercise, good diet would also contribute to, probably lessening the burden of seasonal depression. So all I can say is get out there and get some sunshine as much as you can, and pop some vitamin D, and try to get together with friends and laugh a little, and hopefully that'll lessen the burden of seasonal affectiveness disorder.
So are lifestyle choices like poor diet or a lack of exercise, are they contributing factors to S.A.D? Sarah?
That's a great question. There's definitely been studies that show that things like exercise can help with depression. So trying to get physical activity 5 days a week for half an hour has been shown to be almost equivalent to some antidepressants. So there's that would absolutely be a good thing to incorporate into your lifestyle. Healthy eating is always a good thing to do.
Yes, gaining a lot of ground lately, it would seem, at least, which is good.
Yeah. And things to just generally keep your stress down, so whether that's doing some stress reducing things such as going out into nature, or maybe some yoga or some meditation, would also be good lifestyle choices.
The exercise is one that's interesting for me. So you mentioned 5 days a week. Is it true that, I guess it mimics, like you mentioned, antidepressants because exercise results in the release of serotonin? Is that kind of where things are correlating, or is it just, it's a feeling of accomplishment and that's why I feel good? I'm kind of lost on that one still.
Well, when we talk about something like depression, it exists on so many different levels. So when you mention serotonin, you're referencing the biological level at which depression can manifest. but there's also many other levels. So it's likely that physical exercise helps for depression through a variety of mechanisms. It does have some of the same neurobiological effects that other depression treatments have. It enhances, for example, neuroplasticity in the brain, as do many of the medications that are used for treating more severe depression. But it's also a kind of activity. It's an activity that involves goals and often achievement. It's fun. And that kind of activity is often incorporated into depression treatments. You may have heard of cognitive behavioral therapies. Well, the behavioral part, the B part of CBT, is often focuses on structured activity, getting busier, engaging in activities that would be rewarding or enjoyable. So it probably acts on that level.
Certainly.
And before the show, you were telling us you're a hockey player.
Yeah, well, I do my best. Yeah.
There's a social side too to sports often, and
Certainly.
physical activity often involves healthy social interaction, which is another thing that's good for depression.
It's almost the building of that social capital along the way as well, which helps.
Absolutely.
Generally, people who are suffering from SAD, do they have potential pre-existing mood disorder conditions, or can SAD kind of hit you right out of left field? Is there any correlation there?
You know, it's a good question because the term SAD has become a popular term. It was popularized by a researcher named Norman Rosenthal, who coined the term back in the 80s. And his belief has been that this is a distinct syndrome.
Okay.
But it's not treated that way by most of the mental health professionals. It's a subtype of clinical depression. And depression is not rarely due to a single cause. There's usually multiple contributing causes. So it's very likely that the seasonal variation we see in depression prevalence out in the population has a lot to do with light exposure and factors that are connected to SAD. But it's expected that people with other vulnerabilities will be more profoundly affected.
Right, okay. This is kind of it's a bit of a hollow question, but I think it's important to talk about as well. Is there any stats on what seasonal affective disorder costs the Canadian economy? I mean, off the top of my I can tell you that, you know, depression and anxiety across our country cost the economy roughly about $50 billion a year, which is a significant number. Employers, I'm sure, have struggled with employees suffering from SAD. Any idea as to the cost to our economy?
There have been studies that have tried to estimate the cost. There hasn't been one done in the last 10 years nationally, so I couldn't give you a number.
Kind of tough to gauge,
But on a global basis, depression is now considered one of the world's leading causes of disability.
Is that so?
Yeah, because it has quite a profound impact on people's functioning, including it's a common cause of disability, but also a common cause of impaired functioning among people who continue to work. They're just less productive. Of
course.
So the economic costs are large. It's one of the most burdensome conditions. It's also quite different than many other health conditions because it most commonly affects younger people. So you talk about strokes, heart disease, cancer. These will have their biggest impact on elderly people, many of whom aren't working. Depression has its biggest effect often on people not only when they have careers going, but also at a stage in their life when they might be involved in educational pursuits, establishing important relationships, raising families. So its effect is magnified in these ways. Now, what's the impact of SAD out of that bigger picture of the impact of depression? What our research has pointed to is that there's about a 60 to 70% increase in depression, clinical depression prevalence during the winter months. So that's a sizable impact.
Certainly interesting. Folks, we're going to jump to another break. Stay with us. We'll be right back.